Hello, everyone. This is Dr. Severe Rao from Pain and Spine Specialists, and we're going to talk today about advances in pain management as well as physical therapy. I've told people for years now that physical therapy and pain management go hand in hand, and it's extremely important to be able to find a collaborative approach or a team approach to be able to gel the two specialties together to get people to function better. At the end of the day, it's extremely important to be able to have improved functionality, decrease pain, and just improve quality of life. At Pain and Spine Specialists, we specialize in being able to enhance the quality of living. We have had great success with collaborating with ATI in being able to improve quality of living, improve functionality, and be able to synergize physical therapy as well as pain management. I'd like to introduce Samantha from ATI to say a few words on her approach and her experience.
All right. Hey everyone, I am Dr. Samantha Rodriguez. I have been with ATI Physical Therapy for 3 years now. I am currently the clinic director of our Frederick, Bethesda, and Rockville locations. ATI does have over 70 locations in Maryland, including Mount Airy and Elkridge, where we provide convenient access to care. In physical therapy, our goals are to decrease your pain and improve your mobility to help you get back to the things that you love doing. So what sets us apart from other physical therapy companies is our 4.9 Google reviews and our exceptional customer service and our dedicated care teams that are focused on helping our patients get back to achieving their goals. So we do really prioritize our outcomes and understand the impact that chronic pain has on individuals' lives. So our collaboration with Pain and Spine really does reflect our shared treatment philosophies, and we are eager to maintain open communication with Pain and Spine to ensure optimal care for our patients.
Thank you, Samantha, for those words. That's been extremely helpful for us to be able to collaborate together. In order to be able to enhance quality of living, we need to have a combined team-related approach to be able to identify areas where it's the spine or the joint or the muscles are not engaging properly, they're not functioning properly. And by collaborating, we can hopefully get people feeling better and get them to a more functional state. So as some background on chronic pain is the most presenting complaint to any primary care physician's office. It's what plagues emergency departments. It causes significant amount of problems for so many people around the world, especially in the United States. And chronic pain really comes down to inflammation. Inflammation can affect different parts of the body, different organ systems, as well as the musculoskeletal system. Inflammation causes pain, nerve irritation, muscle spasms, and can lead to debilitating discomfort. It's important to understand how inflammation works, as well as how the nerves send signals back to the brain, transmitting different types of pain. We have two basic types of pain. We have neuropathic pain, which is going to be nerve pain, which is felt like a burning, throbbing, tingling sensation. And we have what's called nociceptive pain, or that sharp achiness that's more arthritic in nature. Both types of pain respond differently to different types of treatment. Often, these types of pain overlap, which is why it becomes very challenging to try to treat pain in general. If you have nociceptive pain, that arthritic pain, we can try to treat that with anti-inflammatory medications, topicals, even muscle relaxers, and sometimes opioids. Whereas neuropathic pain does not respond so well to opioid therapy, we use different types of medications that modulate or change how the nerve sends signals back to the brain. So we can use medications like gabapentin, Lyrica or pregabalin, duloxetine or Cymbalta. These are medications that are indicated to help manage how those nerves are sending signals, how the brain is processing pain. Why do we have pain in general? Well, pain is meant to be a protective mechanism. Our body recognizes that there are different places or areas that can fall subject to discomfort or dysregulation. And in that case, we can cause ourselves more harm if we're not paying attention to what the problem is. So pain is a protective mechanism. If something hurts, it's telling your brain that something is wrong and to get treatment or to stop what you're doing. Chronic pain takes that process that's natural, that's preventative, and scrambles it up. So, for instance, if you have injured a body part, normally pain should improve in 6 to 8 weeks with conservative treatment. That's rest, maybe rice, therapy, physical therapy, and inflammatory medications should help get you back to a recovery stage. If that does not happen, then what we call acute pain then starts to become chronic pain. And chronic pain is a matter of how the brain starts to process what's happening. And the nerves get scrambled, so to speak, and are not sending signals properly. There is a sensitization process that happens, which means that nerves and parts of the brain start to get overly sensitized to pain, which leads to what we call now chronic pain. So, for instance, if you were to touch a stove with your hand, you would pull back immediately without even recognizing it, sometimes without even knowing it happened. But that process happens so fast. So in our hand, we have nerve signals that send a signal from the hand to the spinal cord to the brain and then back again, making you withdraw your hand within milliseconds. But if somewhere along those lines, that pathway, there's a problem, there's an issue with receptors, there's an issue with nerves sending signals, or multiple different issues that could cause that transmission to get affected, that chronic pain can continue and also recruit more nerves to also send signals. So with this type of signaling change, you're going to have overamplification of what should have been a protective mechanism now causing ongoing pain. Now, this can happen at the area that we're talking about. It can happen in the joints, it can happen in the muscles, or it can happen at a brain level. And different types of medications, as well as different types of treatments, are used to target the type of pain that's causing the problem. And like I said earlier, too often, both nociceptive and neuropathic pain work together. So we have to attack them using different modalities and different types of treatments. Physical therapy is a great tool to be able to change the way the brain is sensing signaling, change the way the muscles, ligaments, tendons are functioning so that we can get better overall functionality. In conjunction with medications and or procedures, we can hopefully get more synergy, decrease or improve recovery time, and get people back to a baseline quicker. At Pain and Spine Specialists, we specialize in being able to treat pain with medications as well as different types of interventions. Interventional pain management continues to grow and advance, and I'm very proud and excited to say that our field has significantly grown in the last several years. There are Medicare approved and FDA approved types of procedures that we were not able to offer just a few years ago. So as a reminder, if someone has back pain, spine pain, we have multiple different types of injections or procedures. We can start with epidural steroid injections, which decrease the inflammation around the spinal nerves to get people feeling better. We can also address arthritis-related pain through radiofrequency ablation. And if someone has had back surgery and or has diabetic neuropathy pain affecting their legs or complex regional pain syndrome, we can utilize a spinal cord stimulator to block pain pathways from going to the brain. I would say these are traditional types of procedures that we've been doing for many, many years, but the advances over the last several years now allows us to have more tools in our toolbox. Especially for Medicare beneficiaries, these procedures are covered. We can now put in disc material into discs to improve the integrity of discs and improve and hopefully decrease pain. That's called biodisc. We can do percutaneous sacroiliac joint fusions, which are a quick outpatient surgical procedure, minimally invasive, to help fuse the SI joint, especially if it's responded to SI joint injections, but only given temporary relief. And we can put in interbody spacers for those patients who are suffering from spinal stenosis that may not want a major spine surgery or are looking for an alternative approach. We've been having great success with the MILD procedure, which stands for minimally invasive lumbar decompression. For patients who have what we call neurogenic claudication or nerve-related leg pain, so from spinal stenosis, which is caused by a ligament in the spine getting thickened, we can now go in, decompress, take out some of that ligament, and open up that space to give these nerves more room in the spine to send signals properly. By doing so, this is a 20-minute outpatient procedure. It is not surgery. It is a minimally invasive procedure that has been shown to provide pain relief, but also more importantly, better function. So giving people the ability to be able to stand and walk better for longer periods of time with less pain, and hopefully avoiding a big surgery that may not be necessary. So the MILD procedure has been around for over a decade now, and the data continues to show better and better results. If you have been told that you have spinal stenosis, or if you notice that you have leg pain when you stand or walk, this is something to consider. This is just a few of the most latest types of procedures that have been added to our toolbox. By utilizing these different types of procedures, our goal is to improve functionality and get you feeling better and functioning better. Spinal cord stimulation has been used to treat chronic neuropathic or nerve pain for over 60 years. The stimulator is meant to block pain signals from the lower back and the legs from going to the brain. It does this to help promote better signaling or blocking of pain signaling so you don't feel it as much. Back in the day, these stimulators would send a vibratory sensation. So you feel a buzzing or a tingling all the time. Now, the technology has changed tremendously in the last several years. Now you have the option of feeling the tingling if you want, or you can feel nothing, just hopefully pain relief. The beauty of this type of treatment is that the first step is a trial. There's no incisions, there's no sutures. It is placing an electrode or a wire or two into the spine with the needle under x-ray guidance and just taping it to your back. We try this out for 3 to 7 days and see how much better you feel. If you get about 50% improvement, that tells us that we're using the right type of modality, we're targeting the right type of nerves, and it's worthwhile to have this device implanted. Now, unlike other types of treatments where we give you percentages that we think this is going to work, we solely rely on you telling us how much better it made you feel. So 50% is about the cutoff. We think it's worthwhile for you to move forward with getting the permanent implanted. Now, peripheral nerve stimulation that can affect shoulders, knees, lower back, and hips are also following a similar concept. These specific nerves are getting damaged or injured, and they're continuing to send pain signals. We can do a trial where we place a wire or wires around those specific nerves without any incisions through a little needle. And again, 3 to 7 days, if that gives you good relief, then we can go ahead and talk about implanting the device. So neuromodulation or spinal cord stimulation, peripheral nerve stimulation are great ways to try to target these specific nerves that continue to cause pain, numbness, tingling, or just burning without response to more conservative treatments. When traditional medicine or injections do not provide adequate relief, for instance, if you've had ongoing knee pain or arthritic pain or muscle sprains or strains, and you're not getting the relief you need from, say, a cortisone injection, the next step to consider would be platelet-rich plasma, or PRP. We have been using regenerative mechanisms to try to get the growth factors and healing to occur naturally in the body by using your own blood. We can spin that down through a centrifuge and inject that back into a joint, in and around muscles, tendons, and ligaments. And we've been having excellent success in trying to get people feeling better when steroid injections do not provide adequate relief. If that doesn't help, or if you're looking for more of a systemic approach to feeling better, we have nanoparticles that are available to be able to be used to decrease inflammation affecting the whole body, improve improve your health status by improving your immune system, provide some longevity and anti-aging effects that we can discuss in greater length if you were to come in and inquire. Regenerative medicine continues to be the future, and we are actively looking at all options to try to combine traditional, integrative, functional, and regenerative treatments to get people feeling better.